Hi, everybody. Welcome to this week's episode of Weekly Dose with Dr. Uday. We are going to be talking all about obesity medicine, specifically medications. I have a special guest with us today. I have Dr. Alicia Shelly. And so we're going to be going into this amazing topic. I feel like this is something that needs to be talked about, and it's a big issue. Now, before I get started, I'm going to start with introductions. So, for those that don't know me, I am Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. My goal is to have my patients not only feeling good, but looking good. So let's get right to it. So I have Dr. Shelly here with us today. So I'm going to give you some information about her. She's a board certified internal medicine doc. She's also board certified in obesity medicine. She practices with WellStar MedicalGroup in Douglasville, Georgia. She's the host of Back on Track, Achieving Health Weight Loss podcast. And she also hosts a Thrive for Life YouTube channel. So, and she also is a renowned speaker. So, all great things. So, Dr. Shelly, thank you so much for being here with us.
Thank you so much for having me, Dr. Uday. I'm so excited to be able to come and talk about obesity and obesity medications.
Yes, this is going to be really good. Okay, so awesome. So, like I said, I mean, this is, something that as physicians, we're trying to help our patients with. We are trying to take care of ourselves, take care of our families. And, the consequences of health wise of obesity is far reaching. So, from your perspective, why is it so important to have this discussion about the choice, the options and medicines that are out there for obesity?
Oh yes, because many people in America today and just abroad are dealing with having extra weight, being considered in the obesity and overweight category, and so a lot of times people feel like they're not enough. That they're just exercising and eating less, but they're not seeing the weight come off, and so it can get very discouraging, and people stop. The one thing people should consider is that obesity is a chronic disease, meaning that similar to high blood pressure and diabetes, this is something you always have to keep monitoring and keep a check on. Because even if you were to lose weight, if you were to stop all the healthy habits that you are doing, the weight can come back. So it's always important to kind of be mindful of that. And for some people, there's a genetic component where it runs in the family. If you look at your mom, your dad, your brothers and sisters, aunts and uncles, we're all a little bit heavier set than maybe another family. And so you always have to combat that. I'm glad that we are talking about obesity medications because this is just another arm or another treatment how we can help with battling it. There's no like magic bullet. There's no like one pill that's going to cure all, or one shot that will cure all. It's more of a combination, the same that you see with diabetes and high blood pressure, where you're looking at just the lifestyle as well as, with medications to help with treatment.
Absolutely, absolutely.
Mhm.
I always tell my patients that I see for the same thing that it kind of helps along, but all the other things that go along with it, lifestyle and all that, still need to be practiced. So now this leads to the next thing. So what goes into deciding what medication to pick or use from your perspective?
Yeah. So the one thing I'll mention is that when somebody does like lifestyle changes alone, the average weight loss is usually between 5 to 10% of their body weight. But if you're adding on that medication, it can actually increase to like 15, and soon to be on the market, studies have shown 20% as far as body weight. But that's a medication we'll talk about a little bit later on in the interview. But when it comes to which medication is right for the particular patient, first of all, we have to discuss whether that patient wants to be on medication. Some people are on a lot of medications with their high blood pressure, diabetes, heart failure, asthma, and so sometimes taking another medication is overwhelming. And so I always like to assess the patient first, see where they want to go with it. If they're open to medications, then we'll talk about the different classes and what's available and whether which one would be the right fit. I do find that for certain medications, specifically like the phentermine or the Adipex, that medication wouldn't necessarily be right for somebody who's struggling with their blood pressure or to control it, or whose blood pressure is high, because that is a stimulant and it can cause their blood pressure to increase. If the person has diabetes, that actually would be a good candidate, and they have no history of pancreatitis, and no family history of thyroid cancer. They would be a good candidate for our GLP-1 class, similar to Ozempic, Trulicity, Wegovy. So sometimes certain people's medical conditions can kind of help kind of steer me in the right way. But ultimately, when I have that patient or doing that consultation, we'll actually go through all the different categories and then see which one they're most apt to want to take. The good thing is, and what's so exciting, is that at one point we really only had phentermine, maybe a couple of others. And so now we have such a larger breadth of medications that can help people. And so we can decide based on that person's condition, based on their lifestyle, and just whether they want to start medications, is what we consider when we're about to start.
Absolutely. So you already touched on some of it. So what are the options out there on medications?
Yeah, so I'm going to go back through and just start with phentermine or Adipex. That's been out for a long time, like in the 1950s it started. And so how it works is it's a stimulant. It actually gives you energy, whereas suppressing your appetite. So a lot of people like it because, especially if they're feeling more sluggish and just having difficulties kind of having the motivation and energy to want to go exercise, this kind of gives them that kickstart. With it being an actual with it being an actual stimulant, people can have dry mouth. People can feel some palpitations, jitteriness, especially if their body is caffeine naive, because then they're getting this burst of energy and they're like, what is going on? So it definitely really does help, and it just depends on that person. But I've seen really good weight loss with the phentermine. Also, in this particular stimulant class, you have something called diethylpropion, which is actually, you can take that up to 3 times a day, but it's very similar to the phentermine, but I would say it has a little bit less of the stimulant. I don't have as many patients complaining about the palpitations that you see with it. As well as I mentioned before, if you have high blood pressure, that stimulant can increase your blood pressure. So you want to kind of make sure that you are, checking your blood pressure and actually checking with your doctor first before starting to make sure you're a good candidate. So that's the first, and I would say probably the least expensive of the bunch as far as with the medications. The next one the next popular medication that's out there, and you've probably seen TikToks, you've seen different people talk about this, is your GLP-1 class. Now, when it comes to weight loss, we do see that's FDA approved for weight loss. We have Wegovy and Saxenda. Now, like I mentioned, if you're a diabetic, you sometimes can get on Ozempic, Victoza, Trulicity. These are also in the GLP-1 class, but they're a little bit of a lower dose, and insurance will cover them if it's for the use of diabetes. Right. So sometimes coverage is always a big issue in trying to get people insurances to cover it. But let's just, for the purposes of this talk, kind of stay with your Wegovy and your Saxenda, because these are both FDA approved for weight loss. The difference between the two is that the Wegovy is a once weekly injection, whereas the Saxenda is a daily injection. How they work is they work at the level of your gut, where they're slowing down your gut so you're not as hungry, and when you eat, it helps you to feel full. This can help with kind of curbing your cravings. This can help with eating smaller portions. If you're one of these people that emotionally eat or have a lot of snacking, this can help reduce that. As far as side effects that are concerned, we do see a lot of people complaining of that bloating sensation or nausea. I've had people experience some diarrhea or constipation, and that's just because the system has slowed down. And so sometimes people can feel that nausea. There are ways how to go about that. I would recommend patients, if they're having nausea, to maybe change the site of injection. Instead of the stomach, trying the thighs or behind the arms. And then also they can try giving them the shot at nighttime, and that too can help reduce that nausea. And so that is our GLP-1 class. I would be remiss to say it's probably the most weight loss that we're seeing at this point, is this particular class. And the studies have shown with Wegovy that they can lose up to 15% of their body weight. Now, I did allude to this starting that hopefully sometime this year we'll have a new medication coming on the market. It'll be similar to the Manjaro that we use for diabetes currently, but it'll be packaged in a different name. And when it definitely is FDA approved, it's currently fast tracked. And then studies have shown in their studies for Manjaro that people have lost 20%. And so now they're doing studies looking at people without diabetes. Can they benefit and lose weight as well? And that study is still ongoing, as well as the fast tracking through FDA. So hopefully we'll keep our fingers crossed. We'll be having another medication that we can talk about later on this year. And so that's our GOP class as well. The other classes that we have is, I would be remiss too, is the Qsima, which is the phentermine plus topiramate. So it has a little bit of that phentermine in it, but it's a lower dose. And you have the topiramate that we come together, and it's in one pill. This helps with kind of curbing your appetite, helping you not to feel as hungry, and when you eat, to help you to feel full. And so side effects included with this, similar to the phentermine, where you can have the jitteriness and the palpitations. Also, sometimes with topiramate, you see a little bit of brain fog. So you can see that with that particular class. We have two more classes. We have the Contrave, which works at the level of the brain to kind of suppress the appetite center so you don't feel as hungry. As far as symptoms with that, side effects, you can have some nausea, sometimes headaches. It just depends on the person. I would say the one good thing about it is that it doesn't interfere with your blood pressure. So you won't necessarily have your blood pressure get high on this medication. However, if you're on chronic pain medication, you can't be on this medication because it will actually block the pain receptors and cause you to start to feel pain. So it'll kind of interact with your pain medication. The other thing is, I would say, is that it does take about a good month for it to get into your system because you have to taper up on it. And so definitely, if you're on this, give it some time for it to start to work and for you to see a change with the Contrave. And last but not least, we have the Plenity. The Plenity is basically a natural cellulose capsule that you take 3 capsules before lunch, 3 capsules before dinner, and it actually just expands in the stomach. And it causes you not to feel as hungry. And when you eat, it helps you to feel full. It doesn't go into the bloodstream. It just stays in the gut, which is a good thing. So if you have like other medical conditions, heart failure, things of that nature, it's not going to interact there, or high blood pressure. However, since it does stay in the gut, sometimes people complain of feeling more bloating sensation, just feeling a little bit distended. Also, sometimes because it is a natural fiber, you can have some diarrhea with it. So it just kind of depends on the person. The other thing I would say, there are some medications that are non-FDA approved for weight loss, but we use for weight loss. And that's our metformin that we use for diabetics and PCOS. It helps with curbing your carbohydrate cravings. And we also use topiramate, which we use for migraines, that helps with kind of changing your taste buds. So these would be the major medications that are available for us to use for weight loss.
That is awesome. Now, one big question is, which one of these is covered by insurance? Because patients want to know.
Yeah, that's a good question. So it actually depends on your insurance and the plan that your employer chooses. So not all employers opt in for the obesity rider, or basically the part of the insurance that says that they'll cover weight loss medications. Some of them, don't. They avoid, they take that out, which is unfortunate, because what we do know is that with obesity, it is associated with 270 plus medical conditions. And so if we can get control of our weight, we can get control of those medical conditions. But unfortunately, some insurances don't cover that. So most importantly, it's important that you check with your insurance. I would say since the phentermine has been out the longest, it would be the least expensive. And so you can always use a GoodRx coupon. if you're familiar, or another pharmacy coupon where you can get the price down so that it'll be a little bit more affordable. But usually, like depending on which pharmacy you go to, it could be between 11 and 30 bucks a month, which is still not too much. It's not going to break the bank, but sometimes if you like to get a little bit cheaper, you can go through GoodRx too. But ultimately, it's the insurer.
Absolutely.
Mhm.
Okay. And then with what are the obstacles that you run into trying to help your patients lose weight using the medications?
Yeah. So sometimes I'd find, so one big obstacle I find is that sometimes people have the thought that if I'm on this medication, I don't have to do anything else, meaning I don't have to eat properly, I don't have to exercise. So I will want to stress to your audience that with the medication, it's just a tool. So you still have to do everything else. You still have to change how you're eating. You still have to exercise to kind of help with burning more calories. Because what I did not mention is that our body likes to be at a certain weight or a certain set point. And so when we start to lose weight, we may start to lose weight frequently in the beginning, but it starts to plateau because our body adjusts or adapts to the weight loss. And so it will increase our hunger hormone, also will decrease our metabolism. So in order to kind of keep the ball rolling or the train on the tracks, it's important to kind of add those healthier habits and the exercise so that when you're ready to get off these medications because you met your goal weight, you can be able to maintain it after that. Because sometimes that's the second problem is that some people will take the medication and when they stop it, they gain the weight back. But what I find is that if you're implementing those healthy habits and you're sticking to that, it actually will help you maintain despite being off the medication.
Absolutely. I think that the one of the big things I always tell my boss patients is just, to me, the harder part is keeping it off, you know?
Yeah. Mhm.
But
And
yeah,
that's where that mindset that this is a chronic disease comes in handy because when you realize this is a chronic disease, yes, I may have lost the weight. It can come back on if I stop doing what we're supposed to do. I personally have experienced that. I remember I was maintaining my weight. I was running. I got tired of running. I'm like, I'm not doing anything. And 3 months later, I gained 20 pounds. And I'm like, what just happened? What just happened? So I'm a testament. You can't stop. You got to keep going. So when you're creating or you're doing these healthy habits, make sure, is this something I can do for the rest of my life? It needs to be a lifestyle change. It
uh,
needs to be a lifestyle change. Mhm.
not a sprint, it's a marathon, guys. Not a sprint.
Yes.
And we're all
Yes. Mhm.
the same thing. So we're with you on it.
Mhm.
Okay, so the other thing is I'm actually gonna switch gears.
Mhm.
And this is a question I always ask all my guests. Why
Mhm.
what you do, doc?
So why do I do what I do?
Mm-hmm.
All right. The reason why I really enjoy obesity medicine is because I struggled with my weight since childhood. And so it was, being able to go into this field has helped me open my eyes to kind of what's going on in my body, but then also it allows me to be able to help others too. I know people may look at me and be like, I have one patient say, you don't know how it is to lose weight or to gain weight. I'm like, oh yeah, I do. I do. Uh, and so this going into this field kind of helps me to stay on top of it and then and to be consistent, and then also it helps me to help others. So I truly enjoy this field. That I am so impressed with just how this field has grown in the last several years, and I'm excited that we have more options and more tools in our toolbox to help others. Mhm.
That is an amazing reason to do it. And so you kind of are, you know both sides of it. You're
Mhm.
helping and you know exactly how it feels. That is amazing. Um, this other question is completely unrelated, but the answer always helps my viewers, so I always ask
Mhm.
it. And that question is, if you had an opportunity to talk to your 20-year-old self with all the experiences
Mhm.
that you've had so far, what would you say?
Mm. So if I could talk to my 20-year-old self, so my 20-year-old self would be at the end of her college career. And actually the funny thing is that at the end of my college career, I had lived off campus. And so I was cooking for myself, I was exercising, and I had lost weight. And I'll tell you, for graduation, I looked good. So what I would tell myself is to not stop. Do not stop. Lord have mercy, it gets hard because after that I studied abroad for a year. I went to medical school, and so life got away from me, and I started gaining the weight back. But I would say, number one, make this a priority. Like, put exercise in. When you're 20, you don't have to do much. You may exercise 3 days a week. Now that I'm 40, I gotta exercise 5 days, 6 days. I gotta make sure I'm like, well, how many calories is in this? Like, I have to be on top of this. And so when I'm like, if you're 20, I'm like, man, don't stop. So whoever's out there, you're in your 20s, you may be your 30s, you may be your 50s, 60s, 70s, don't stop. The secret sauce, and I'm going to tell you, the secret sauce to weight loss is consistency, is you keep doing it every single day, regardless if you want to or not. And that's what I would tell myself. I'm like, stop playing. You better get your butt to the gym, or you better go walking. You better do something. You better watch what you're eating. So that's what I would tell myself.
So many gems in there, but I really truly believe that those big results we're all looking for is hidden in those everyday habits. So you just hit the nail on the head, Dr. Shelly. Thank you so much. This is so good. Okay, so actually, for people that are looking for you, want to connect with you, where can they find you?
Yes, you can find me at Dr. Shelly MD on YouTube and on Instagram. Also, you can go to my website, drshelly.md.com, to learn more about what we're doing here. Also, I have a free online course for you if you're trying to get started with your weight loss, and that is the thriveforlifechallenge.com/kickstart. So feel free to go on there and get some more information, more tools for your toolbox as you're trying to and have a more healthier lifestyle. Mm-hmm.
So awesome. So you guys heard it. Check her out. And if you're looking for a primary care physician that cares, give us a call at Apple Valley Family Medicine. Our phone number is 304-350-1007. And you can find us online at www.applevalleyfamilymed.com. All right. Thank you so much. Have a great week, y'all. Bye.
Bye.